In Italy, travelers arriving from China now must be screened for COVID-19. India, Japan, and the United States have introduced similar restrictions. China believes these rules target its citizens unfairly. COVID response measures need to be science-based and proportionate that treat people of all countries equally, says this spokesperson. Hospitals in China are swamped. Restrictions in place for years were suddenly lifted a couple weeks ago. The population has little natural immunity, and vaccines used in China are widely seen as less effective, stoking concern among experts.
What we might see is the fear of a repeat of what happened in 2020, 2021, with a new, more virulent and more transmissible and more fatal variant spreading.
Most travel rules have been eased worldwide. Bringing them back misses the mark, says this infectious disease physician.
Society is pretty open these days, and so the average person's risk isn't necessarily going to be from that person that comes off a plane. It's going to be in that gathering, that restaurant.
And travel restrictions really wouldn't be able to keep variants out, says Chegla. In fact, Canada's public health agency says the variant driving infections in China has already been here for months.
You really can't play a whack-a-mole game trying to identify particular countries when, in reality, if it is more virulent, if it is more transmissible, it will be here one way or another.
What new measures could do is buy a bit of time for a healthcare system already under severe strain from COVID, RSV, and the flu.
It may delay the onset of cases. We'd be more able to deal with a number of cases.
As of now, Canada isn't screening travelers from China, but the Public Health Agency tells CBC News it won't hesitate to put in measures if required. Julia Wong, CBC News, Edmonton.